this is Clover A. Perez, and
Hi,
welcome
Tom.
to the first episode of Converse with Clover. So, we just recently changed the name from Women Unfolding to Converse with Clover because we have been getting a lot of emails saying that we need to broaden our audience and kind of broaden our topics. So, I listened, and this is why I have changed the name so we can now have a much more broader audience and talk about different topics. So this evening, I have a friend, Didi Rodriguez. She is the owner of Didi Dolls. And
Hey, dolls.
welcome to Converse with
Thank
Clover, the
you.
first episode of Converse with Clover. So I am going to turn it over to you to give you an opportunity to introduce yourself fully.
Okay, sure. Hi, everybody. My name is Didi Rodriguez. I am a post-op and body contouring connoisseur, educator of all things aesthetic. And as of right now, I have a business called Didi's Dolls. We do all types of beauty trainings there, from medical assistant to body contouring, even facials. And we also do services too. So love to see everybody. And I have 10 years in the business. I am a 3-time surgery doll. So I like to make sure that I let people know that so they feel more comfortable. And I also have out a surgery magazine right now that gives you all the different steps to your surgery process. So if someone wanted to do liposuction or something, I give you the beginning 4 steps, the pre-op and the post-op stages. So everything is in there that you'll need to know, from nutrition down to what to buy. Thank you for having me.
That's a beautiful introduction, and thank you so much
Yeah.
for your transparency. I never put that out. I just allow people to say what they want to say.
Thank you.
So, I would say for the past 5 years that I've known, right? It could be longer. Size acceptance, body positivity, and activeness it's really about, it's talking now more about women getting their body done and the reason behind that. And so we oftentimes we hear that, okay, it's because of these video vixen, they want to get their body done, to have the
Mm.
Coca-Cola bottle shave like Beyonce, Nicki Minaj,
Mm.
that. So tell me, why do you think there's an upswing of women getting their bodies done?
So for me, my personal experience, I felt like you kind of are given what you normally have, right? So
Mhm.
what your mama looks like, your auntie looks like, and in my family, we just didn't have any hips, right? So for me, I wanted more of a feminine shape to me. So I was kind of a little top heavy at one point. I had a little bit in the back, but I wanted more of a curve to my hips. Had I known that when I got older, they were going to pop out, I might have waited a little bit. Because once you hit that mid 26, 27, 28, the weight sits on you, that womanly weight. But
Mhm.
I did my first surgery in 2014. I did it strictly for my own purposes, for my own body positivity, my own thoughts about myself and what I wanted to look like. And you can run on the treadmill a million times a day. You're not going to get hips if you don't have them. Okay. You might get some booty, but you're not going to get hips if you don't have them. So for me, I wanted to do that. And then over time, I started to become a little bit extra top heavy. So I decided I wanted to do a reduction. It was hurting my back.
Mhm.
I felt like it was kind of making me feel slouchy a little bit. And I just realized as I got older, they're going to grow. So I went and did that for myself. And all of these things were for my own self awareness and self love and how I wanted to feel. So they weren't for social media. There wasn't even social media really in 2014. It's like
Mhm.
Facebook. Wasn't for Facebook back then. It wasn't for a man. These were things that I wanted for myself. But there are so many other women out there that want them for different reasons. And I feel like every reason is really valid if it makes sense to you.
Really?
I
So,
do.
do you ever wonder, um, is it pleasing, or would it be pleasing to God, that you enhance your body and instead of being grateful for what you was given?
Honestly, to tell you the truth, I love Jesus. I love God, and if God can forgive people get in a car accident and moving on and not seeing if the other person was okay, he can be okay with me making sure my back doesn't hurt for sure.
Okay. All right. Well,
Fine with that.
everyone has different views.
And you know what? Whatever people believe is in their own right, in their own mind, in your own house, and
Mhm.
out my face and my business, or out Shirley's face and Shirley's business, who just saved up for 5 years to do her tummy tuck after raising 6 kids. Mind your business and do it in your house. But it's also not right for people to push their beliefs onto others.
Absolutely.
And I
Absolutely.
think that that's a big problem. You know, you have the popular site, The Shade Room, and you
Mhm.
have people on The Shade Room. And as soon as they post a girl with a curvy, oh my God, these girls are still getting their bodies done. Oh my God, I can't believe it. I hate it. I hate it. It's not your body. You don't
Right.
even know this person or where she live at. So those are the things that I don't like. I don't mind whatever reason people do it for. I don't like when people hate on other people for doing it.
Right. And so I had met someone who was in a car accident, and she had a big dent in her booty, right? I don't know how is that possible, but she did. So she had to have surgery on her butt. And
Mm,
they molded so nicely, almost like a heart shape, and it looked really great. So,
mm,
now people not understanding the reason why she had that done is so quick to judge people and say, well, you know what? Guess what? She got her butt done and she shouldn't have done this but you don't know people's reasons for example, you said about your breasts, right? Um,
mhm.
you needed to decrease the size because it was heavy and it was causing
I'm
problems.
ready to go back again because they grow back over
They
time.
grow back?
They can grow back if it's hereditary, yes.
Oh, wow.
Based hereditary or diet. As I get older, my weight fluctuates, even if I'm taking something or I'm working out or water weight, it still fluctuates. So in my family, women are top heavy.
Okay. Okay.
I'm always
That's
gonna naturally be top heavy because that's just the way it is. Do I want to be top heavy if I don't have to?
no,
No.
no.
Yeah.
And do you think that one of the reasons why so many women are getting their body done is because now it's much more affordable, or now they have different
Mm.
insurance, you can apply for loan, you can do all
Yeah,
things
yeah.
now.
So, when I went for surgery, we opted to go to the Dominican Republic. Now, my girlfriend is Dominican, and her mom was actually living between Brooklyn and DR at that time. So we still went when we went over there. It didn't feel like a foreign place to me, even though it is a different country. I still knew people there that were English speaking. Our cab driver spoke English. At the recovery house that we stayed at, they spoke English. So, my second time I went, so I had nothing but pleasant experiences, honestly.
Okay, okay.
I can say that we did go there though because it was cheaper,
It was
right?
cheaper.
So a 360 lipo, which is what I got. My first time a 360 lipo was maybe 4,500, $3,500,
Okay.
3,500 and $1,000 for your recovery for 10 days, right?
Mm-hmm.
Um, or I think at that time it was 800, it was $80 a day. Now, these people are taking amazing care of you also. So you are getting 3 meals a day. You're getting your clothes washed, your sheets done, brought bottled water, your feet rubbed, everything. It was awesome. Had we gotten it done here at that time, we would have both been paying $9,000 a piece.
Wow.
So
Wow.
we were under 6,000 for our surgery, all of our medication, our labs, the recovery house, and cab fare and flights under 6,000, 6,500. So you still saved money somewhere.
Somewhere. So can you explain what a 360 is?
So 360 is just kind of a complete circle. So that would just be from the belly button all the way around your waist back to the belly button. Now, different doctors have what they consider 360. So some doctors may do mean like your whole front all the way up under your breast to the bottom of your breast, the diaphragm, and your back. So where that bra fat hits in the back, all the way up and around. You got some doctors here in New York or in Miami that consider just your stomach and the arch in your back 360. Now, if you want to take it up higher underneath the breast and that bra fat, now you're adding something else. So they found ways to lower the price but are you going to be happy with that?
Right.
So there's always a little give and take here. And in the United States, doctors are only allowed to take out a certain amount of fat
Right. That's
versus
what I
other
heard.
countries.
Other country. Okay. And
Mhm.
why is that, do you think?
For safety purposes, they have to regulate it somehow. Um, in DR, they will probably snatch you to your ribs. You never gain weight again. So over here, not only do they want you to come back, which they probably can get you to come back because they snatch your waist and then, or do your back, and then now your front is big, or vice versa, whatever, right? So here we have more options and more resources, like you said earlier, to get access to money and credit and different things.
Right, right.
So that doctor seeing you that one time he did your 360 lipo, now you're like, oh man, my waist is so small. I need to do my arms. Hey, well, come on over here to this payment plan. They're going to give you this amount of money and you can pay it back over 3 years. No problem. All right, you know what? Let me do that. In other countries, cash is king. If you don't have your money, you don't have it.
Wow.
Here, they can charge you based upon you coming back. I
Okay.
worked in a plastic surgery clinic at one point. I was a post-op and aesthetics manager. It was a pretty popular one. This is 2019 and 2018, I'm sorry. And they would give you a natural BBL.
And what
And
is
then that's when you get your fat put in your booty. So they would do your lipo and they would put your fat in your booty, right? Um, and it wouldn't look like they did much. They would tell you you have to come back again for your second round because you were slim. We didn't have enough, which could possibly be true. But the more you see people doing it, and the more they tell you, well, you're going to need 2 rounds. You know that it's about the money. They can get you to
part of
come
the
back again.
money? Right,
I've
right.
seen girls in the post-op room when I did their massages hysterically crying. I did all this for a flat butt. So you have to also be very vigilant and very careful
Mhm.
about who you go to.
Right, right.
Mm-hmm.
And do you think it's addictive as
I
well?
think for some people it can be, yeah, because you see such a dramatic change when you first go, right? Or when you first get that surgery, that change is there today. And we are a society of instant gratification.
Right.
We want something right now. If I drink this beautiful drink, I want to feel it right now. That's the society that we're in. If anyone tells you, oh, buy this makeup, this foundation is going to leave you flawless the first time, you're like, oh, I need that. I don't want to waste three layers of foundation, waste too much makeup. So as an instant gratification society, we want it. But there's also people who aren't only about that. You have people that possibly may have body dysmorphia.
Right.
Body dysmorphia, one of my very good friends, she says that she has that sometimes. She looks great. She eats good. She has a beautiful job, beautiful shape, wonderful person. She's always like, I need to do this. I need a little touch up. I need this. I need this. I don't like it. And at some point, you're like, girl, you don't need anything. You're the bomb.
Hmm.
But it's about people's perception of themselves.
Right, right,
So we can change on the outside, but can we really change the way you see yourself on the inside? I've
right.
seen girls with their surgery and after they say, girl, I still look in the mirror and see myself as that overweight girl at 16. We can't change that. Surgery can change you on the outside, but if you don't do that inner work in here and up there,
Hmm. I have a girlfriend that's like that as well. She dysmorphia. She can't even look in the mirror when she's getting dressed at all.
I feel
Yeah,
so bad. It hurts me to
cannot,
hear that.
no, she cannot, she thinks that she's always fat. She doesn't like what she wears. And I'm like, are you for real? Do you look at your, but she can't see that, so now she's getting therapy for that to deal with that.
That's
But
wonderful. We need to encourage therapy.
hmm so, body image is a multi-dimensional construct, right? And I
A
think,
lot of layers.
right. And when you look at what the tools that they use to measure African American compared to their white counterparts, it's so different, right? So someone that may have a really healthy shape, right? Or, healthy weight, I should say, a nice shape, that may look like that person is heavy, right? And I think that especially for the younger people that's coming up, the younger girls, what the media portray as beauty, of what sexy looks like,
Mm.
you know, and
Very
that
good point.
yeah, they now you know, it's inside of them, you know, like you said, and you have to now work to change your inner thoughts, right, of what beauty looks like. So it's so important as women, and we have kids, especially girls, right, that we have to instill positive affirmation, right? We have to say
Mm.
that, you know what, you look beautiful. You don't have to be like that other person over there. You are unique, right? You have your own characters, you have your own beauty. Everyone is different. No two leaves are the same, right? It doesn't mean that, you know, you should not embrace your look, your body, you know, and things like that. But so I believe that media does play a big part in that. So what do you
Mhm.
think that I guess really lead to this trend? Because now we see so many women are getting their body done. Now they're going to this new spot now, where's this Turkey? They're going to Turkey to get their yes.
I know that the men were going to Turkey to get their hair done. They're like, you go through the airport, everybody has a bandage on their head. It's a new thing. Men are getting themselves together too. They're doing their lipo. There's some rappers now that are coming out. Kanye has done his lipo. Drake has done lipo. Funkmaster Flex has talked about it several times, and his love of food and how he has strayed away from it. He was too heavy, pre-diabetic. So, man, to circle back what you said, I think that the new trend is coming from accessibility.
Right.
It's accessibility, but it's also social media and TV. Now more than ever, they're fine with putting a half naked woman on TV. Back in the day, you only saw that on BET Uncut at 1 o'clock in the morning. BET Uncut came on after Midnight Love. Now, as soon as you go to your phone and open it up, it's somebody with a thong on.
Right.
And then who's to say you don't see that your man is underneath there like, wow, girl, looking great. And you're thinking this man told me to wear jeans outside and a long sweater, but this is what he likes. He never wrote looking great under my picture.
So you know what? That's interesting because I was watching I think Fox Soul, and they did a survey of men that with women that have their body done. And believe it or not, 80% says that they like women that are natural, right? They're
Mm.
natural. So and I'm saying they don't believe in that get that butt enhancement. They don't believe in, you know, adding to the hip. But if you see that, even though they claim that they don't like that, they are really
It is a false, false,
right. They
false
are going to
world. They are liars. Every man wants a woman that looks good, unless this man is insecure. Unless your man is telling you, hey, get in the gym, or hey, baby, I love that, and you look great the way you are. And everybody wants a partner that they are sexually, physically attracted to. I mean, some people are, sapiosexual and sapiosexual, where they are intrigued by people's mind, makes them attracted. Most people are physically attracted to people, right? At the end of the day, I do believe that women are taking better care of themselves now. So it's like the grandmother now is not your 1980s
no,
grandmother.
no,
This
absolutely.
grandmother is fine as hell. This grandmother is slim and body. Bernice Burgos will take your man. Okay. So these grandmothers out here are gorgeous. 50, 60, 70 years old does not look like it looks years ago.
Absolutely not.
This
Absolutely
woman has raised her children. She has raised her husband, because we know men.
right.
She raised her children, her husband, probably raised some siblings, has worked jobs, and still now has the grands. This woman is sick of feeling not like she looking how she's not feeling inside, right?
Right.
So if you feel like you're youthful, you feel like you don't feel like how you look, right?
Right.
It's okay to go and do something and make yourself feel better. Now, men say they like women who are more natural, but at the end of the day, there's nothing wrong with someone doing something to change appearance. Now, if you married her and she looked African American and now she looks like Michael Jackson, I understand that. You didn't marry this white lady.
No.
You married this beautiful Black queen.
Right.
But I was on a podcast the other day, and he said, I do prefer a more natural woman only because at times you want to know what will your children look like with that woman.
Right, right.
So he in that podcast, he told me a story. There's a man in Asia, married a woman, and when they had children, the children didn't look anything like her. This woman had had so many surgeries to pull her rich, wealthy husband. He wound up suing her for defamation of character.
Wow.
The children didn't look anything like this lady.
Oh my God.
Yes, so it can be serious in certain circumstances, but a little nip and tuck to get rid of that baby pooch should be fine.
Listen, I don't, first of all, I don't have a problem saying that I had my lipo on my stomach, right?
Mm.
Because you have some women after you have, especially me, I had a C-section and I had that little fupa and I needed to get rid of that fupa. It doesn't matter what I did as far as exercise.
That's what I'm saying.
That
Mhm.
fupa never went away. So for my reason, my personal reasons, I said, you know what? Hey, let me look into getting the lipo done on my stomach. And it's the best thing that I could have ever done. And
I
now
would do it
I'm
again, all
thinking,
my surgeries.
and
Yeah.
now I'm looking at now getting my arms done. It's not that I'm lazy to exercise, but in certain areas of your body, it doesn't matter how much exercise you do.
And Clover, a lot of times this stuff is hereditary.
Right.
I
Absolutely.
met Mama Clover. Mama Clover is beautiful. I met Mama Clover. She is a complete angel. So sweet, right? As you get older, you are going to transform into Mama Clover. I was going to transform into my mother. My mom had 2 pancakes. I don't want them. And it's okay to not want 2 pancakes, but I can say that I did do my surgeries. Instead of doing another one now, I am going to wait till I try to conceive or see what happens there. And
Right.
after that, 1 year, 2 years, I'm going to be signing right back up, girl. Because I like being snatched. It's part of my lifestyle now.
Yeah. So, what would be the cutoff age? Say someone wants to get the 360. What do you think
Ooh,
the
good
cutoff age
question.
would be?
You know what? Honestly, 100% it has to do with health. It has to do with health. So when you do your labs and stuff and see if you're healthy, so someone who maybe has thyroid condition, someone who has like astronomical blood pressure or different stages of diabetes, if you have started to become sickly, I would say don't do it. So
Yeah.
whether that's going to be in your 40s or that's going to be in your 60s, because I've had a client before who was 63
Really?
and she did a tummy tuck and she did a little bit of lipo and she was 63. This is a few years ago and she looked great. I mean, could I tell she was a little older? Yes. The laxity and the not as much elasticity in the skin, right? Not as much bounce back. This woman worked out. She had a good job. She was married and she said, "Hey, I waited all this time to do it." And my husband said, "Just go do it. If you're gonna do it, do it. Just be safe about it."
I just be safe about it. Right. Right.
Because people can be sick in their 30s and 40s, girl, and not even be able to do it. People getting sicker younger, whether it's food, working environment, I don't know, but it does happen. Yeah.
Right. So let's delve into this big booty now, right? So that's the Brazilian butt lift, right? Is that what it
It
is?
can it can be, yeah. What do you think about that?
I don't know. I don't know anything about that. Is it the same thing that they remove fat from other part of your body and then insert it in? Okay.
Yes, so a BBL, it can be one of the most dangerous surgeries as
Right, that's
well.
what I
A
heard.
lot of people hear that, but that's because you have a vein down in your booty. So you have a vein, which is like an artery, right? So there's always a chance of possibility something happen. But I mean, do I feel like it's any more dangerous than getting a tummy tuck where you're split and split? No, not really. Once you have a doctor who's knowledgeable of how to do the BBL and have a good success rate, you should feel comfortable to do that. I can say one of the biggest regrets I hear about surgery is women not doing the BBL after they 360 lipo. And then they're saying, damn, man, I should have did it. I should have just, it was my fat. It was my fat to deal with. I shouldn't have thrown it away. I should have just did it.
They should have just
So,
did it, right?
yeah, so that's one of the biggest regrets I do hear about it. But I think that the BBL is just has to do with your taste.
Okay.
So there's different levels to it. So you got like natural BBL. So that's the girls that are kind of like the athletic look, like a slim fit girl.
Hmm.
She only has enough fat to have that little booty anyway. Then you have a girl who's a little bit thicker and she just wants a little fluff. She doesn't want a huge ghetto booty, right? Then you can go into the girls that are thick and they want it to match their legs, right?
Hmm.
So, hey, my legs are super thick. Just make sure that you give me this. And then you have a huge butt like mine, and you're like, what? Where did we go wrong? What happened? What happened? But I can say that I actually didn't get a BBL ever. I got booty shots back in the day when they were popular. This is 2012, 2013.
Wow.
Had I known that I was going to gain some womanly weight later, I probably wouldn't have done that. I would just have done my 360 lipo. Might have not gotten the butt fillers because once you gain your weight and you do get a little bit of booty, now your booty is a super booty. It's a mega butt.
We hear a lot about even I would say 10 years ago, a lot of women are getting those shots in
Mm-hmm.
black market shots, and a lot of things were happening to these ladies. Some, they would lose their legs or infections and things like that. Has it changed now?
Absolutely. So when I did my booty shots, of course, they were illegal back in the day, just like almost everybody. Just a few to name a few, K Michelle, few other Instagram models and stuff. People have done it and say, you know what, this isn't for me. I've actually had two different removals. So I did two removals of the butt injections. I wasn't having complications. My skin wasn't changing colors or anything like that happened to me. But I did think about my long-term health because I got silicone. So
Oh,
silicone, they were just using in small amounts for lips, for cheek fillers. This is back then. When you get it in such a large amount, the tissue around it may start to die because it's not breathing. So nowadays we have hyaluronic acid fillers. So you can actually do a 100% legal liquid BBL, they're calling it.
okay.
So now you can come to different shops, search people, and see where you can get it done. And when they do it, they're actually putting in a water soluble filler that is healthy. Your body will absorb it. It also may help to build collagen and elastin and stuff. So it's hyaluronic acid. They can put it in your face. You can do it here, but they do it in larger amounts in the booty now. You're not going to get sick. One downside to it is that it can absorb a little bit over time. So as full as it might be in the beginning, it doesn't stay full like that. That was like that silicone
Okay.
filler that doesn't break down.
Hmm.
This breaks down with your body. So your body is gonna absorb it. Comparable to when girls get their lips done and they gotta go back every like 4 to 6 months, they keep going, then they get crazy with it and start ending up like this.
Like a cat woman.
Exactly. But it's comparable to that because your body absorbs the filler over time. They
Right.
can't put something in you anymore that just stays and is just dead. Because tissue grows, tissue moves, you have veins and stuff.
Right.
So same as that.
Right. Do you think that some women overdo it? Because you see some women, they have this big butt, right? It doesn't even match their body.
I think it has to do a lot with personal taste too. Um, I'm not a fan of super big implants. I actually the look that I love and I love to see on women is I like women who are evenly proportioned. So I just me visually, I'm obviously not into women, but the visual look I like is I'm fine with you being big on top and big on bottom. I think that's cute. That's my personal preference. I
Okay.
also like the look of being small on top and a little larger on the bottom, right? I'm personally not a fan of super big implant breasts, and people go bigger and bigger. But to me, that's not what I like. But hey, the target audience that she's, they say if you're looking for a white man, just get some boobs. That target audience that she's looking for, he might like it. Would my husband, who is interested in my body, like? Probably not.
Probably not, right.
But there are things as a society that we don't like. For some reason, we just don't like that cat lady face. That
No, no,
we don't
absolutely.
like that. To me, that's overdoing it.
Yes, definitely.
Um, there's a lot of instances of people overdoing it for sure. But can we tell them not to?
No, absolutely.
Yeah.
Absolutely. So I know that massage is very, very important when you have any of these procedures. Explain how the massage works.
So after your surgery, even before, which is a really great idea to book it before, so you're not home trying to find somewhere that can take you for the appointment on the day that you want to go and the time. I suggest to book your massages before, but lymphatic drainage massages are people to take care of you after you get home from surgery. That's what I do. I love it. It's one of the great loves of my life. I love taking care of people. This was better for me than like home health care, that type of field. So I like to do this. When you come after surgery, you're going to come, we're going to assess you, we're going to take your pictures. We're going to talk about your experience with your surgery and what you had going on. And then I am going to figure out what you need that day.
Okay.
Now, if you have fluid that has accumulated over the last few days, maybe you didn't get a massage, or maybe they didn't do it a different way, or maybe just your body did that to you. Now I'm going to drain you. I'm going to take out that excess fluid, give you some relief, and help your results to heal. You don't want to have a pocket of fluid can turn into seroma. You can get sick, right?
Hmm.
The next thing that we do is I try to make sure you have the correct garments. So we call them fajas. I love fajas, Clover.
Yes, yes.
We call them fajas. And then there's other accessories you can buy. So front boards, back boards, foams, those things are going to aid. So I like to see you between 10 to 20 times. It sounds like a lot, but it's really not if you think about you have 3 months of healing.
Right, right,
After surgery, you have 3 months. Can you imagine coming to somebody 20 times in 3 months? That's nothing. That's almost like coming once a week,
right.
right? So I think, but the crucial part is that first 2 to 3 weeks after surgery, super crucial to make sure you have your massages.
Yes, very,
Yes.
very important. Very.
Mm-hmm.
I can't even stress that. And I don't do the work that you do, but I know that for really good results, the massage is so very important. So very
I
important.
feel bad for people who don't know about it. I worked somewhere and one of my coworkers said, "Hey, I have a client, and she couldn't even lay back and get her lashes done because she did her lipo a month ago and she's in so much pain." Do you know that was my client for like 5 years?
Wow.
I took her on. She had almost like a book bag, like a knapsack on her arch in her back. They lipoed her back, her arch in her back, and her thighs, and they put it in her booty for her BBL. They never told her to put on a faja, to
What?
put on any compression. So she was just walking around just in complete pain. She has started to develop fibrosis. Fibrosis is when the tissue starts to, I guess, turn into scar tissue
Yes.
and harden up and the fluid, and it becomes very hard and very painful. I broke her down. She came to me for many, many packages over the years just to come and do a little bit of this and a little bit of that. And it worked. But there goes to say that a lot of doctors will take the money. They don't even suggest any of these things to you. So it's very important that women know what to look for before surgery.
Right, right. And a complaint that I hear often is that in New York, as you said, they are allowed to take out a certain amount of fat, right? And so you will go and you want to get the lipo on your arm, you want to get lipo on your stomach, you want to get lipo on your back. And so oftentimes when that's done and you come home and you wait 3 months or 4 months, you see that there's not a lot that's taken out because all of that compiles and make that amount, right? And they're not being
Yeah.
told that. So the expectation level is that when someone has that, their
Ooh,
arm is going to
good
be
one.
small, their stomach is going to be small, their back is going to be small. When no, you still have a stomach that you may have to go back again and get another lipo. You have to go back again and get a lipo on your arm. And it bothers me that you have these folks or these surgeons, as you said, that's doing this, and they're not being transparent about that.
I believe that 100%. I hear that often. I've heard that, doctors are going to do the surgery on you, even if you've been sick, even if you didn't stop smoking, you told them this and that. They're people also, they want the money. One of the biggest things I think people need to think about is you need to make sure that the doctor you're going to is a board certified plastic surgeon. What they don't tell you is that in the United States, any doctor can do plastic surgery.
Really?
Yes, you are not just put in a box to only do what you specialize in. So, the plastic surgery clinic that I worked in Manhattan before, the main doctor, the owner of the clinic was a pediatrician. He was not a board certified plastic surgeon. He should not have been doing surgeries, BBLs on these women. Just because you know how to do it doesn't mean you should do it. I probably have enough knowledge and seen enough surgeries to possibly perform a liposuction. Should I do it if I studied writing and literature? Fucking no.
No.
Excuse my language. That pisses me off so bad. So you really have to make sure it is called a board certified plastic surgeon. These plastic surgeons have been vetted, they have been trained, they did their internships and everything. And the community, the board has decided they are fit, whether they have supervision or not, they
Wow.
are fit to do your surgery. And they get awards and everything.
I love that what you said is, and I believe in that. It's so important to do a check on these surgeon to make sure that they are
Mm-hmm.
board certified. That's number one, and to just really look at different reviews. Speak to some of the people if it's possible
Mm-hmm.
they have worked on. And I don't necessarily believe in just putting up pictures because you can put up pictures of anyone. Doesn't necessarily mean that you did the job, but just if
Mm-hmm.
it's possible to just go into the office, see how they operate on a day-to-day basic, and just basically see what they do. Just have a
I
conversation.
think that it's very important to have your own list of questions. So it is very important to go to your consultation or your virtual consultation and have a list of just questions that you want to ask. I also believe it's very imperative to meet with your doctor before surgery. Now, whether that's a few days before when you arrive in Florida or whatever, but you do need to see your doctor before you physically go into surgery in the morning. There have been instances of people waking up and mid surgery, someone else is performing it on you.
Really?
Yes. So it's so important to do your due diligence to yourself to figure out who you are going to. And there's so many different resources you could use. So you could go to some surgery groups on Facebook. That's where clients are just like regular people are talking about their experiences. They don't allow doctors' offices or nurses or recovery houses to enter. It literally is just a forum for women for surgery. That's a really great resource because they're giving you their honesty and opinions. They don't get paid for it. They're just regular people.
Right.
Another forum, another website you could do is Real Self. Real Self is where you can actually physically look up the doctor's name, and then people are going to write reviews, whether they're good or bad. So you can see the tea on Real Self about
Oh,
that doctor.
wow. Wow. That's great
Yes,
information.
the tea is on there, and you can see what happened, how they
Right.
were treated. But there's also some beautiful things you could see also. Um, you can see how someone's bedside manner was. So my third surgery, I went with a wonderful doctor. When I woke up the next morning, my doctor was at my bedside with flowers.
Nice.
Yes,
Very
it
nice.
was
Very
such
nice.
a different experience than my first two times.
Mm-hmm.
So my first lipo, we'll have to have another date for that. Talk about our surgery experiences. We'll have to have another date. But my first two experiences weren't exactly how I wanted them. But my if we talk about them, this is gonna go viral on here. My last experience was wonderful. I would do it over and over and over again.
Wow.
But I did research my doctor. I did decide to pay a little bit more this time. Even though I went to DR, he was board certified plastic surgeon in the United States.
Oh, awesome.
He
Awesome.
spoke English, but he had his own practice over there.
Right.
And I got my surgery done in the hospital,
Right.
not in a little tiny clinic in
Right.
over on the side. Yeah.
And I believe also that um because there's a lot of people that's going to different countries, the third world country, to get these surgery done, they're not doing extensive research on these doctors, and that's why you see a lot of them. They have these blotch surgery, or a lot of them die as well.
Or they'll be sitting in the clinic and you be sitting with 10 other people there waiting to go.
Wow.
10 people waiting to go. Whoever's labs come in first, you going. Whoever got the most priciest surgery today, you gonna
Right.
go.
You go.
Now they're gonna give you your medication and you're gonna be asleep before they take you in the back. And now this other doctor is about to do you.
Oh my God.
It's
Well,
real. It's very
it's
real.
real. Well, this is good information. Thank you so much. We
You.
can't tell people they do whatever they want to do, but this is really, really good information that if someone is
Thank
even
you.
thinking about getting it done, that they need to do their research and even look at the sites that you mentioned. So if
Yes.
someone wants to get in contact with you, how do they reach you, and any final words?
Yes. Somebody would like to get in contact with me. You can reach me at Dee Dee's Dolls on Instagram. So it's DEDES as in Dee Dee's, and then my dolls. So DOLL and then three S's. So Dee Dee's Dolls on Instagram. I am so happy to be on your first episode of the new Let's Chat with Clove. My Miss Dr. Clover Perez. I'm also so proud of you.
Thank you,
By
my
the
love.
way, I'm truly honored for you to have me here. You could have chosen anybody and you asked me. I feel like we do have a wonderful, wonderful working relationship. And I look forward to any business ventures you have or anything you have coming up. Always let me know. I
Thank you.
would love to do this again. And I'd be
Absolutely.
honored once again. And the next time we can definitely make some flyers, promote it, whatever you need, I'm at your service.
Yes, well, it definitely will be promoted. So
I
thank
got
you.
you.
We'll also put the links, so people
Yes.
reach out to
But
you.
meaning that we should do a live. We should do an
Yes.
Instagram
Oh,
live.
absolutely,
Yeah.
absolutely. Yes. And
Okay.
for anyone that wants to know, okay, I did not get my butt done. Okay, because
Oh no, Clover she didn't get her butt done. She
I
did
just got
her
lipo on my
lipo.
stomach, and that's it. And that's the best thing I could have done. I feel so great. So,
I
so
love
great.
that.
As I said, I'm thinking about really getting my arms done because I have my arms are so big. I hate them, but in
I
everything.
can tell you that once you do your arms, they kind of stay like that. So arms are they're a great investment for sure. I
Okay.
think you would really like it. You do still have to get post-op care after because you have to get the fluid removed, same as with anything else.
Right.
But the arms, the recovery time is fine. You're a little bit sore, but you can go back to work and everything.
Okay. Awesome.
Totally different experience.
Okay. Thank you so much. I
Thank you for
really
having me, mi
enjoyed
linda, my
this
angel.
conversation. Thank you. Thank you. Thank
Thank
you.
you, Clover. Have a wonderful evening.